Missed that.
We're started?
Yeah.
Okay, dispatch for a 32-year-old male patient who's been involved, got hit in the head by some steel on a construction site. It fell 2 floors up. He's bleeding from his arm and he's unresponsive at present. We arrive on scene and we approach our patient. He's unconscious. There's somebody around. Your foreman? Yeah. As I approach, I'm asking what happened. So as we approach our patient, we start CAB. I look, there's a big gash on his arm. I'm going to turn to my trauma bag and I'm going to grab, do you want to hold his head still for approaching? I'm just going to grab my trauma bag. This is a trusty Ziploc bag at this point, hopefully. And I'm going to grab one of my firefighters. You got some gloves on, some gloved hands on. Come on over here. Just to expose this big wound here on the side. You guys are going to find the blood. Big gash there. Put pressure right there, please. Good amount of pressure. I noticed that he's got irregular respirations, but I'm just looking to see if there's any other signs of any blood around, so that life-threatening bleed. Okay, I turn my attention to his airway. Do you want to just fire open his jaw and see if we can see anything? He's a little bit bitey, hard to get in, but as I pull a jaw thrust, I am able to get up. Let's just suction him because I can't see in his airway, and he's obviously unresponsive. Can you hear me? No? He's like, yeah, that gets his attention, but not really. Okay. Okay, so we take suction, just going to suction him out, suction airway, suction, suction. I just say I get some secretions, no blood. How's your bleeding going there? You able to manage pressure? I'll be back to you in a second. So we're going to put see if he'll take an OPA. He's not responding to anything, so I think he may. So open his jaw, I'm able to get his jaw open, I insert an OPA, put it down in, he's got an OPA in place, okay? Breathing, notice is he inadequate? Do you want to just bring your knees up on either side of his head? I'm going to give you a bag valve mask to bag him if you want to hold his C-spine like that. Because he doesn't have adequate minute volume right now. I'm just going to give you some oxygen. High flow oxygen up, reservoir bag is on. Reservoir bag's on. She's going to try getting good chest rise and fall. See if we get good chest rise and fall. I'm going to grab your stethoscope. It's very convenient you had it on. And because we're having issues with breathing, I'm just going to turn and make shake, see if I can get good chest rise and fall now. So nice big breath with the bag valve mask. Just every time I put my stethoscope on, just give a squeeze. Okay, I'm getting equal chest rise and fall all over. So we got ABCs taken care of. He's obviously load and go. I'm just going to do a quick rapid assessment. Going to look around for his head. Didn't see any bleeding on the top of his head. He's got a bump on the top of his head. He's got some blood. Okay, a little smushy, but doesn't seem to be depressed. In the back of his head, nothing in ears. Okay, neck, trachea's midline. Didn't see any of it, evidence of trauma. Pushing in the clavicles and chest. You can expose, if it's a nice warm day, I'd cut his shirt, cut his buttons and cut and rip his shirt off. Don't see anything. Anything abdomen. Okay. How's your bleeding coming? Still bleeding a bit?
Still bleeding a bit.
Is that abdomen pad full? Okay, bleeding doesn't seem to be controlled. We're just going to throw a tourniquet on. You keep pressure on there, and I'm just going to put a tourniquet on. Just lift his arm up. Few controlled breaths. It's always good for everybody. Okay. Oh, don't need to go back through the belt. Okay, I'm just going to tighten that up. Grab his arm. And I'm going to pull, and for Mark's sake right now we're not actually, but I tighten until the bleeding stops, and I should have no pulses to go with that. So I can strap that, pull that through, strap that all down, make sure nobody cuts this. Gets excited and trapped. Can you take your pen? You can take pressure off there. That bleeding should stop. You write your time with the pen. Write it on there.
51.
And just check out his pelvis. Okay, pelvis stable. No incontinence, no priapism. Femurs seem stable. Legs stable. Cap refill. Good cap refill on both legs. We'll get his legs exposed once we get him. Okay, let's get, I think we need to get going with him quickly. We're going to grab our collar and our scoop stretcher. Do you want to go grab our scoop stretcher out of our truck? Pair those straps up so they match. And we'll get a collar on him. We're stuck here anyways, breathing for him. So, it is what it is. I find rather than measuring with my fingers, I just take it and set it on him and see what works well. Does that make sense? Rather than measuring out, so I just lay it beside him and see if it fits, and then go from there. You're a firm regular. Be a country regular. Country regular. So with regular gas. Let's call it in here. Just position it. How's that? Is that comfortable for you for the time being, Mark? You can deal with it? Okay, he's unresponsive. Okay. We're just going to get him strapped in. Are these both the same length?
Yep.
Okay, let's flip his leg up. We're just gonna try to bring these together. You want to hold his head just so we don't move his head back and forth. We don't. We gotta come towards the top. We gotta clear.
It's caught in a blanket.
Okay. Okay. I'm just gonna take a little bit of a weight out of his hips so they can flip over. I'm not gonna move him. I'm just gonna. Slide in there. Can you clip his feet in first? Okay. Just once again, hold his head still there. There, perfect. Okay, strap him in. That one goes. These here straps, you just have to loop around and then hook on itself.
Okay.
To go in there. So loop right here. And down here, I'm just hooking on the metal for the time being. We're going to come over the top of his shoulder and then pull down. And if you just want to hook that on the metal, and we'll strap his arms probably in because he's unconscious. I'm just hooking that in like that for the time being. Just hook on the. Is there metal you can hook on there somewhere? No, maybe I'll have to come down and have a look. If you want to do this, oh, that worked okay. Sure, whatever. Sounds good. Oh, just hook on the metal. Is there somewhere that you can hook in like the other one? You just hook beside it, that'll be fine. And just come across. It's not ideal. But normally we'd have pegs to deal with, but in this case we don't. Okay, so you want to run to the truck and get the stretcher. How's our breathing going? Still getting good chest rise and fall? Bleeding, still no bleeding at the site. Still unresponsive. Radial pulse, still strong and pounding. Stretcher just over to the other side. Okay, bring it on in. Okay, we're going to do a 4-person lift because we got 4 people. We're at a good height, I think. So we'll do 1 at each corner, but on the inside. So once we're ready here, you give them a couple. We'll give them a few breaths, just kind of quickly, hyperventilate, I guess, for 5 breaths or so. We've been breathing well for them anyways for a couple of minutes, so we should be good. Okay, we'll just set that to the side. Okay, so we're going to lift on my count on 3, and then we're just going to, once we're standing at full height, we're just going to take a step to the side. If we had somebody else that could push the stretcher under, sometimes it's just as easy to step to the side. Okay, everybody comfortable? Eye contact with everybody, good? Okay, on 3. 1, 2, 3, up we go. Perfect. Okay, let's get them strapped in. This one I'm just going to tuck under his arms. I'll explain why later. Do you want to shove that one under his arm? And this one's going to come up. Oh, we got 2 more. Shoulder straps come up. You're right on. So tighten the one going across his body first. So you'll be able to tighten. No, I'm not on the strap to tighten. So tighten this one first. And so we're going to lift him up and take him off to the stretcher, into the back of the truck. Partner, you're off driving. I am bagging now. So we get to the back. We ventilate him as we went. And then once we get to the truck to get him in, set the bag down to the side, get him in the truck, then go back to the head. Don't need to be trying to bag for him as he's going in and out of the truck or climb in out of ditches or that sort of stuff. Just good ventilation before and then move him up. I'm going to take fire with me, if you're willing.
Yeah, sure.
Okay. Do you want to come up and have a seat in this airway seat? Have you used a bag valve mask before?
Yep.
Okay, perfect. You're going to drive. Code 1 to QEH. Away you go. Woo, woo, woo. Okay, you can go have a seat. You don't have to pretend to drive the whole time. I'm going to pull myself over a bench seat. Very convenient. And I'm in the truck. So we've moved him. We've hauled him out of the ditch. We've been bagging him back and forth. I'm just going to reassess the level of consciousness. How much time to the QEH? How much time left till 20 minutes?
5.
How many minutes?
5
minutes. Okay. So I'm going to call the QEH just after I check. Still unresponsive. Bleeding's controlled. Got radio pulse. And I'm just going to listen to breathing now that someone else is bagging, just to make sure that it's adequate. Breathing's adequate. Okay, QH, you copy?
Yes.
Island EMS Unit 60, we're currently transporting a 30-year-old male patient who was involved in an industrial accident at a construction site. A piece of steel fell from 2 stories up, hit him in the head and the arm. On arrival, he's unresponsive, had an uncontrolled bleed in his left arm, which we've applied a tourniquet. He was also ataxic in his respirations with inadequate minute volume. We've been able to put an OPA in, have suctioned him, and we're currently bagging him a breath every 6 seconds, and so 10 breaths per minute. And we'll get you some vital signs once we have them. We're only 5 minutes out. I'll keep you updated as we get more stuff done. We'll see you in 5 minutes. So I'm going to turn, grab my SpO2 and my defib, which is on the shelf beside me. Going to have to grab this arm here. I'm just going to unclip this arm out. Get over your arm. Put the blood pressure cuff on. Normally I'd like to put the SpO2 on somewhere else, but because he's got one arm with the tourniquet, I don't think I'll take an SpO2 on the one that I know is cyanotic and blue and looks dead. So we'll put the SpO2 on this finger here. Turn my monitor on. As I turn my monitor on, I'm going to see my SpO2. I'm going to hit my menu button. Menu. I'm going to go to my measurements and alarms, NIBP, schedule for 5 minutes, every 5 minutes. And I'm going to, I got a good SpO2 at 100%, great job bagging. I can make sure that we're not hyperventilating. If he's at 100%, I'd say let's take a blood pressure, and that's going to go every 5 minutes. His pulse is, we'll say 60. and blood pressure will be back in a minute. Going to evaluate, is there anything else that I need to do as far as life-threatening things that need to be addressed at this time? I think at this time I'm going to start a large bore IV on him, so that we have access, and then I'm going to do my rapid secondary. Partner, how far are we, Charlie?
2 minutes.
2 minutes. Your ID bag. Oh. Okay, we'll have to get you another one. Oh. So let's say we've got a saline up, and we'll start an ID. I won't take the 2 minutes for the time being. Just going to do my quick, I'm going to do a secondary assessment now because we've done reassess the level of conscious ABC, got a set of vital signs. Did somebody come along from, I should have asked, your factory worker friend came along. Do you know if he has any allergies to any medications? Or do you know anything about his past medical history?
I don't know anything about
past medical history. Usually a fairly healthy guy.
Yeah, he's a healthy guy. He's
Does-
good.
Doesn't have any history of lung or heart problems that you know of, or any seizures?
No, not that I believe so.
Not that you know. So we don't know, and you don't know if he's on any medications.
He does take something, but I'm not sure which.
Not sure what. Okay, so we have no idea for past medical history, don't know about allergies. Look for medical alerts, don't see anything. Okay, so very limited in past medical history. And he was unresponsive right from the time he got hit in the head?
Yeah, as soon as he hit the ground, he was motionless.
Okay, so I'm just going to do a quick secondary assessment, look at that little gash in his head. It's bleeding a little tiny bit, I'm just going to leave it for the time being, make note, I could dress it if I had more time. Just push in on his facial bones, everything seems stable. Trach is midline, no JVD. Blood pressure's come back at 204 on 106. So he's showing evidence of Cushing's here with his bradycardia, irregular respirations, and hypertensive. Deep breath, I still feel symmetrical chest rise. If he wasn't exposed, I would cut and rip clothes off so I'd have him fully exposed. I'd probably leave his underwear on him, but everything, like I'd leave his pants, there'd be chaps up the side, and his shirt would get cut up the center and get ripped out underneath the belt, and I would just cut, and it would just be laying kind of like a blanket underneath him. Then we can check his back. Hope there's nothing on his back because we're 2 minutes away from the hospital.
1 minute.
So look a little bit more. I can shove my hands in, see if I have any blood of any sort. I don't seem to have any blood. Hope so. We'll see. Okay. Abdomen, is it still soft? Cut. So undo straps. Cut, rip, look, see if there's anything needs to be exposed, and off we'd go. I could cut and rip, like if it's a warm day outside and I'm not concerned about it becoming hypothermic, then I could cut his clothes on scene as I'm doing my rapid assessment. Once again, I can't see a reason I'd take him out of his underwear, but I might cut up the sides and cut his shirt. Is generally cut up the sides of the pants and cut his shirt is generally what would happen if he's unresponsive. It's good. What did I miss? Straps done now. These ones would be across with the shoulder straps in. You'll have 3 buttons you need to press, and this is a reason why you don't want to intertangle your straps, right? Because if he pukes, I want to be able to press 3 buttons, and for him to be off the stretcher and still on the stretcher. Are you recording again? So I'd go pop, pop, shoulder straps go over. I'm going to grab his strap. You're not going to be there. It's just going to be me in the back of the firefighter. And I'm just going to grab and pull him towards me if I can. Jump and mark. Okay, ready? 1, 2, 3. Okay, so we're just going to roll him over and pull him up. And then we're going to grab our suction. Grab the suction. We're going to suction them out. Right?
That's funny.
Okay, and then we're going to roll him back. 1, 2, 3.
We probably should have given you a heads up.
No, he was unconscious. He didn't need a heads up. But we need to be able to roll him over quick.
If you weren't so close to the hospital, would you take his head off?
I would not take him off in this situation. You'll notice that if he's a big, what I'd call a polytrauma, if he was alert and had a cut in his arm and was stable, no signs of shock, or if I had a long transport time, I'd take him off. In a short transport time, I didn't run out of things to do in order to take him off the backboard. he's going to be totally fine. He's not brittle diabetic or a geriatric patient that's likely to develop skin ulcers. Where people get into problems is if they have a little bit of neck pain and they lay out in the emergency department for a couple hours. Or if we're transporting somebody that just got rear-ended, or a geriatric patient that fell, hit their head, maybe broke their hip as well, we'd put them on the stretcher. And because they're stable, we'll take the time to unclip, pull the scoop stretcher out, leave them flat with the C-collar in place, and just lay them and take them that way. But in this really big polytrauma, we'll just not waste the time on it right now. Sometimes it's also splinting long bones that we haven't got a chance to splint yet. So it gives us something to secure their body to as their bones are wiggly. Okay?